Hi, Mark Scott here with Munevo, and would like to introduce you to Dr. Rex Marco, possible new Munevo Drive user. Dr. Marco, do you mind introducing yourself?
Yes, hi, I'm Rex Marco, and I live with C3 quadriplegia, and I was injured 4.5 years ago, and I've been using a sip and puff driver. Before that, I used a chin driver, and I moved away from the chin driver because it was really hard to adjust on my chin. My caregivers had a difficult time getting it to the right position. It would come unlatched, and a couple times it would come unlatched and fall away from my chin near stairs, and one time or two times it drove me between cars. So then I was introduced to the sip and puff, and that was an amazing switch for me. I had a lot more control, and at the same time, it's still something in my face, in the way. It does not help me feel like I'm not living with a disability, because something is always there. And moreover, it's really difficult for me to talk and drive. If someone is walking with me, or I see someone along the way and they say hi, I cannot feel comfortable when I say hi, because I have to pull away from the straw, and that's an unsafe situation. And sometimes the sip and puff would actually swing away from me and out of my mouth, and that's a very uncomfortable situation because I have no way of stopping it or controlling my speed or turning at that moment in time.
So your profession right now, obviously you're a doctor. What's your specialty?
I'm a spine surgeon and a musculoskeletal oncologist.
And how long have you been living? How many years have you been living with your injury?
4.5 years.
Awesome. So some of the challenges that you're going through, we're going to set you up in a Munevo Drive today, and we'll see if we can answer some of those challenges.
Okay, great.
Your son is so cute. Oh my God.
Look at me, I'm driving and talking at the same time.
Oh Lord, as long as you ain't texting or drinking.
He's not even shocked. You know how hard it is for me to drive and talk at the same time?
I know. Oh, I know.
It's impossible with my other driver.
Now come this way and turn this way.
And I can do that with this.
There you go. Turn back my way.
You can see you're impressed.
Oh, okay, the video.
You can be in the video.
I charge for that.
Now, come here. Find your home and disengage drop. Go to seating.
Okay, Munevo. Go to seat. That's a lot quicker than the sip and puff.
Okay. Can you get back out?
See if I can back up.
Quick pressure release, huh?
It was really quick. It was really nice that we've been able to find that adjustment, because I was concerned that I wouldn't have enough motion in my neck and head to allow me to get up and down.
So we've taught you a little feature that you're using. Do you see the benefit in voice activation? So
I do.
So how quick can you get to drive from there, your seating?
Really quickly, if I say Okay, Munevo. Go to drive. And I'm in drive.
I like how you tighten that turn up by dropping your chin. That's pretty smart. I think you're showing off. Okay.
Takes a little bit of time to get used to. But these new adjustments have been really helpful.
So, whoa, that's pretty good.
Yeah, I was trying to show off.
So, if you wanted to just converse and talk and not have your glasses active,
Yes, to deactivate my glasses, I tilt right and hold it, and then it shut off, and
they're locked.
now they're deactivated and locked.
So you would, and to unlock them, you do the other side. That's awesome. Quick question. You and I were talking a bit ago when we were setting up your glasses. You said you had a Jayco arm.
Yes, I do.
So we're excited about that because that Jayco arm can be controlled on all four axes with just your head movements.
Yes.
No joystick required.
Correct.
Awesome.
Yes. I have a robotic arm, and the Munevo glasses can help control those with my head motion alone. The difficulty with the sip and puff or the chin driver is that I have something around my mouth, and it's not easy to use the robotic arm to drink or feed myself with another straw in my mouth. And I also am hopeful that the robotic arm will allow me to play games with my son and continue to practice communicating with him and with my robotic arm. There's also a camera feature here. I am not able to take photos reliably with my own phone, as it's difficult for me to use my voice to voice control my phone, but the Munevo glasses have a better active voice activation that can hear me better, and I also have the ability to practice using a mouse with my Munevo glasses.
That's awesome. Well, Dr. Marco, I want to thank you so much for your time. Again, we learn right alongside you. So I appreciate the education you've given me over the last couple of days that I've been in the Houston area working with our rep. And thank you so much for your time and the interview. I appreciate it.
Oh, you're welcome, Mark. Thank you so much.